I think the best way to describe it is like, it's not accident and emergency. You're not in a ward. You stay in a best way to describe it is like it's like a safe place.
A safe place is exactly what Adrian needed. He struggled with his mental health since he was a child.
It's one of those that is kind of self-contained.
Oh wow!
Yes.
This is all yours?
Yeah, it's all mine.
A week ago, Adrian tried to take his own life. He was brought here to Barnsley Street in East London.
So it's a single bed. You have pretty much everything that you need.
It's part of an NHS trial helping people to recover in the community.
Were you in crisis when you came?
Yeah, I was. I was in proper state. It just kind of all happened at once. Got the keys, I moved in, and be like, yeah, you're part of redundancy process. And I just literally it's like a plane crash. I know I'm quite, I'm talking here with you now today, but I can also be extremely quiet. I'm not very demanding. I don't ask for things, but really struggle, kind of be like, hey, I need help.
Yeah.
Typical guy.
If this wasn't here, where would you have gone?
I don't know. Like I could be on the street. I could be homeless. I could have spiraled completely out of control. Obviously being suicidal and all that stuff. Cannot be here at all.
So a space like this ultimately saved your life.
Yeah.
Barnsley Street is one of 6 sites around the country described as neighbourhood community mental health centres. Patients are encouraged to be independent, but there are psychiatrists, nurses and support workers on site to provide care, advice and medication.
It's like drop a glass and it breaks, so you shattered. So you just kind of giving those few days to kind of pick up all the fragments and just kind of not glue it together, but kind of, just put yourself together.
The hospital is just 10 minutes walk down in that direction, and we'll be going there regularly, once a week, say, to go and see people in A&E or other wards there.
Adrian is under Shiraz's care.
We'll go and see people, and once we're sure that there's no physical health issue or other reason to stay there, we will bring people back here to carry on the conversation and to make a plan of what needs to happen next.
Hospitals across the country are struggling to cope with high numbers of patients attending A&E in a mental health crisis.
They're actually now expecting us to come, so now they're used to us. I think there's a bit more of a flow because they know that someone's under our care and we need to go and see them.
This project has been inspired by a programme adopted in Trieste in Italy, and it's been copied by many other countries across Europe.
We don't exclude anyone, so people that might have a psychotic illness like schizophrenia, people with bipolar disorder, depression, and people who are struggling with their emotional regulation and suicidal thoughts. And the idea is we get to know people really well. We don't want to refer them to multiple different teams, we don't want them to go somewhere different.
NHS England is impressed by the results so far, and it's considering opening more community sites. But Barnsley Street only has 2 years of guaranteed funding.
Our hope is that we can keep that resource coming and to try and make that money permanent so we can really lay down some roots and start thinking about our care long term. So I need a good 10 years to really show what we can do. I think it would be great if we can reduce our reliance on inpatient care and inpatient treatment, but we know that if you don't provide enough in the community, then people will struggle.
Yeah.
And without that support, they end up in A&E, end up in crisis care services, and then ultimately sometimes on the ward.
This time last year, I was asked to see for myself how King George's Hospital in Ilford, East London, was struggling to cope with the number of mental health patients in their emergency department. It was overwhelming for patients and staff.
We're getting on average about 15 to 20 mental health presentations to the department. Some of these patients can be really difficult to manage and really complex. If a patient's in crisis and wants to harm themselves, there's lots of things in this area that you can harm yourself with, so it's trying to balance that risk and make sure every emergency department in the country is deemed a place of safety, but there is a lot of risk that comes with emergency departments because they're not purpose-built for mental health patients.
She was just such a caring person. When I reflect now, I'm like, she wanted so little in life. She just yearned to be loved and to love others.
Chanel Thompson's family is demanding change to come faster. Chanel had suffered a lifetime of mental health challenges, living with extreme anxiety and eating disorders that saw her sectioned. She died from a cardiac arrest that she suffered in an emergency department while waiting for a mental health bed.
Even in a moment where actually her physical health was the issue, you know, she had a cardiac arrest, but it was just another time that the mental health system has failed her. You know, we spent hours even just trying to reach out for some help.
A coroner ruled that if Chanel had received one-to-one observation as planned, she might still be alive.
It's no disrespect to the people working within it, it's the system that is failing both the staff members and the patients. It's a traumatic place. If someone is completely dysregulated and in a crisis, that is not an environment you should be in. It's a busy area, there's so much going on, the nurses, etc. That's not the ideal place, which is why they end up being left waiting and unnoticed.
Do you think if you had gone to a dedicated mental health space instead of going to a very busy ED, the outcome would have been different?
100%, because there would have been the staff would have had the training to understand the complexities and the varieties of mental health challenges that one could have. The system is failing, but the reality of a failed system is a loss of life for many individuals, and that's unacceptable.
NHS England knows it needs to do more, but the man in charge of the country's mental health system warns that services are stretched.
People waiting a long time, a lot of people waiting, I think is a very big challenge for us. I think up and down the country we're meeting that challenge, but we know that we've got to do a lot more in that area.
Patients waiting for years for an autism diagnosis doesn't sound to me like you're meeting that challenge.
No, I agree, it's not acceptable. We know that there has been a huge demand in people coming forward. It takes a while to meet that challenge, but we're aware of it and we're determined to do all we can. We know that there are gaps and we can't fill those gaps straight away. For example, it takes years and years to train a psychiatrist. If we want more psychiatrists, we have to wait for them to be properly trained, make sure that they're adequately supported.
I spoke to a patient who uses this service this morning, and he asked me to ask you, why aren't there enough mental health beds? What would you say to Adrian?
So the number of beds have fallen within the last 15 years, but we have moved to a more community-based treatment service. We do have high occupancy rates. It's an endless tension. It does partly depend upon the staff that you've got available, because if you open a new ward, that takes up an awful lot of staff, and at the moment our staff can only come from a finite pool, so we would then have to take people away from community services, and community services is where most people want their care to be. So it is a delicate balance.
It's just kind of important to be, you know what, stop, I need help.
Yeah.
Adrian doesn't know if he'll need to use this neighbourhood mental health service again, but for now at least, it's here if he does. But other mental health patients around the country who live in fear of their next crisis may not have the same support when they need it. Ashish Joshi, Sky News, in East London.